Hi, I'm Dr. Catherine Anoha, the owner of Natural Medicine Center at 315 Doris Drive in Lakeland, Florida. And as a head practitioner here, it's my joy to help others to find healing with natural and holistic options. I want to thank you for taking the time to watch this video, which is going to be on thermography and breast health. Now, this is a political topic. This is a controversial topic. So as I talk to you here, we're going to kind of compare and contrast mammograms versus thermograms. These are two different screening algorithms. And as I said, this is a controversial topic, but every woman needs to find for herself which protocol she'd like to go with to maintain breast health. Now, the FDA requires for me to point out to you that a thermogram is not a substitute for a mammogram. And I would submit to you, thermography is so much more. I would also encourage a kind of a paradigm shift or a thinking shift. I'd like women to think in terms of breast health. So there are many practices, and you can search this website to view breast brushing as a general health practice. That fosters breast health. Also hormone balancing. Also techniques for mobilization of lymph fluid. All of these practices, which I have blog entries on some of those topics. This is what can be embraced to keep your breast tissue healthy. Mammography advertises itself as early breast cancer detection. But mammography is actually finding a tumor mass after that breast tissue has already changed to form a tumor. Common sense is going to let us recognize that when the tumor is already present, we're not actually having an instance of early detection. I would encourage women to instead be on watch for the signs of breast health. So with breast brushing, with lymphatic propagation, with hormone balancing, we can forestall any functional changes in breast tissue. Because really and truly, if a tumor is going to prevail, if a tumor is going to establish itself in one's breast tissue, there are a lot of telltale signs that would precede the establishment of that tumor mass. So that tumor, in order to prevail, would need to recruit a blood supply. In order to do that, it would invoke the patient's normal inflammatory processes in order to draw a blood supply from arterial bases over to feeding the tumor. We would be able to see that in thermogram. Furthermore, tumor cells, they really and truly do act as armed bandits. They do not abide by the standard practice rule set of healthy body cells in your body. Okay? First of all, they can become immortal. They can disown the normal cell division tactics and reproduce out of control. They, as I mentioned earlier, can usurp all of your inflammatory pathways and build a mini empire for themselves, and they can metastasize in that way. Furthermore, tumor cells will emit toxins locally to kill off neighboring somatic cells in that area and broaden the turf for their own growth. With the emission of that toxin, we're able to see patterns of that toxin being cleared over into lymphatic systems on the sides of one's body. So between these different patterns, the recruitment of new blood supply, so neovascularization, angiogenesis, we're able to see that with thermography. We're able to see the clearing of toxins, as I just mentioned, and we're able to see low, subtle signs of a tumor mass in development. So thermography is truly early detection. When it goes without much question to say that if the tumor is already formed, I'm not sure that's an early detection. But again, FDA requires me to mention that thermograms are not a substitute for mammograms. And once any anatomical changes are evident in breast tissue, mammograms can certainly be useful at that point. So more differences between mammograms and thermograms. Mammograms are using electromagnetic energy, electromagnetic waves, which can be dangerous. This would be the same for other imaging methods, to include CAT scans, PET scans. The good news is that thermography does not involve any radiation. We are sensing temperature changes using infrared light with extreme precision. So I can see 0.01 degrees Celsius changes in breast tissue. The controversy, because as I said, this is a controversial topic, concerns the decision of which modality is better for breast imaging. Okay, although thermograms are not an alternative, there is a way to see a lot about breast health with thermograms. Furthermore, thermograms avoid harmful radiation. There is no compression of the breast tissue, no injury done to breast tissue. At the Natural Medicine Center of Lakeland, our thermographics team can capture higher resolution thermographic images of your breast tissue or alternate body tissues. And these images will be assisted by a team of specialists who are interpreters of thermographic imagery, and they will be able to spot any abnormal changes in the body, any asymmetries, any telltale signs of infection, lymphatic congestion, or alternate anatomical changes to diagnose a problem. With the help of these interpretive reports, I'm able to see you again at the clinic and lay out a plan for optimal breast health. The Natural Medicine Center is proud to offer a radiation-free imaging service to our clients. Please schedule an appointment today for an on-site consultation. Another thing I'd like to point out is in the area of false positives. So even as is published on Susan B. Komen's website itself, the statistic is published there that in 10 years of annual screenings, a woman's chance of getting a false positive mammogram outcome can be 50 to 60%. Now that false positive, the chance of that is even more profound if a woman tends to have dense breasts, such as what is common with younger women, or fibrocystic breasts. It is with younger women in mind and women with fibrocystic breast disorders. It's with them in mind that I really suggest that you seek out learning more about thermograms. Also, in support of some of the statistics that I've just called out to you and some more information on the controversy at hand, I would recommend you to look through the excellent text that's entitled Mammography Screening: Truth, Lies, and Controversy. And that book is by Peter Gersten. Thanks so much for watching this video on breast health and thermography. Follow us on our Facebook page and like us on Facebook. You can also search this website or search our YouTube video offerings to see more blog and prepared works to give you information about breast health.